And India, as you mentioned, is going through a massive COVID-19 outbreak, fueled in part by the spread of a highly contagious variant of the disease. This past Saturday, the country reported its highest daily death toll from COVID, 4,187 people, all in one day. Here in Chicago, some groups are working with overseas organizations to donate supplies and relief funds. And joining us to hear more are Santosh Kumar, the Executive Director of the Metropolitan Asian Family Services, and Dr. Sajal Tanna, an infectious disease specialist with Northwestern Medicine. Welcome both of you to Chicago tonight. Both of you, as with many in the Chicago area, have family in India. Starting with you, Santosh Kumar, how has this hit close to home for you?
Namaste to all of you, first of all. I'm Santosh Kumar from Metropolitan Asian Family Services. I'm here for last 4 decades, and I'm serving our community for last 30 years for Metropolitan Asian Family Services and Universal Metro Services, and we are serving the senior population. And for personally, as you asked, my family is in very much danger. I have lost 4 or 5 people already, and right now 4 people are in the hospital in a very critical condition because of the lack of the oxygen there. So India is a very heavily populated, densely populated country, and this pandemic is taking a toll on the very high number of the people. As you know, the statistics, it is spreading exponentially, where 300, 400,000 people in a day it is infecting. And yeah,
it's certainly an apocalyptic situation right now. Dr. Sajal Tanna, before we get to some of the issues behind this, how about your own personal feelings about what's happening? Has this hit close home to you as well?
Yes, I'm an infectious diseases physician over at Northwestern who's been taking care of COVID patients, but both of my parents are both originally from India. Almost all of their siblings are still there, and our family as well has been very hard hit. Most of my relatives have been lucky enough to stay at home, but at the same time, we've lost some close family friends and extended family members to this disease.
All right, Santosh Kumar, what are some of the efforts, at least in the Chicago area, that are underway now to sort of help the situation over there?
Chicago, we are trying here in many avenues. Like Seva International, we have collected $8 million and sending the oxygen and the vaccines and other PPEs, stuff for the hospitals to the people. And they have thousands of volunteers, they are working there. And then we have a Red Cross India. We are helping them through different organizations like a FIA Chicago. And then we have a private people, doctors, engineers, they are sending, and like a Mall of India also sending. And many people are sending to that. But it is not enough for India kind of population. I urge the world community to help India right now to stop the spending right now. If we fail to stop right now, then it will spread the whole world, because this is a very dangerous mutant has come. It is spread like in the air, and if go to and it doesn't know the border. It crossed the border anytime.
And you mentioned it's a very dangerous new variant. Dr. Tanna, this is a very complex question, but what exactly caused the current outbreak in India, and how dangerous is that variant that's spreading right now?
Sure. I think that the current outbreak is multifactorial. It's been caused in February. India was really a success story, and things had opened up. People were having social gatherings, people were having weddings, religious events. The variant began to spread. It's commonly known as the double mutant variant, which is a bit of a misnomer, but it has 2 predominant mutations. One is the one that's found in the variant from California, which makes it more infective or more easily transmissible. And then it also has what we call the EEK, or the E484K variant in the same location. That one seems to evade neutralizing antibody, as we've seen in the variant that originated in Brazil, the P1 variant, and also the one that originated in South Africa, the B1351 variant.
So India went from a model country on coronavirus to the situation it's in right now. Santosh Kumar, there's been a lot made of the low rate of vaccination there. Only 10% of the population with 1 dose, 2% fully vaccinated. India is known to have to be pretty advanced in terms of the medical industry and coming up with things like medical products and vaccines. How come it is lagging here?
It's lagging because of the thing they have a lot of very good pharmacy system there, but they need the raw material, which I think Biden government has stopped for a while. That is causing a delay in the vaccination. Otherwise, India has helped 30 countries. They have sent free vaccination to all these 30 countries before when the first wave was there. But now they are lagging because the world community is not helping in the raw material.
So perhaps helping out with that, sending more vaccines. Dr. Tana, Santosh Kumar mentioned the oxygen supply for patients in hospitals right now. What can be done about that crisis, a crisis of an oxygen shortage?
Yeah, so there has been a gift waiver for oxygen concentrators that can be sent abroad, which is great. That removes some of the ambient nitrogen from the air and makes the oxygen more purified for patients who are sick and that need it. People need oxygen. They have not enough oxygen cylinders. They don't have enough oxygen to fill them up. They don't have enough ventilators, and they don't have enough staff to healthcare resources, healthcare workers to actually run the ventilators.
And Dr. Tana, we had a debate on this show about the prospect of relaxing or suspending vaccine patents. Would that help the situation in India by suspending those patents, as President Biden now supports?
Absolutely. I think prioritizing people over patents is very key in decreasing the disparity between the rich and the poor countries. The Biden administration has made a major first step in saying that they support the World Trade Organization in getting rid of these patent or waiving the patent rights. But this isn't going to happen overnight, and we're not going to be able to vaccinate our way out of this surge. And so really sending relief and aid, like Santosh Kumar mentioned, is really going to be key in helping the people of India before they lose even more lives.
Certainly seems like the only solution here is a worldwide solution. And our thanks to Santosh Kumar and Dr. Sajal Tana. Thank you so much for joining us.
Yeah.
Thank you.